Welcome back to Healthwise, and we're speaking with Dr. Ronnie Daigle. We've been talking, well, a dermatologist from Lafayette in the Acadiana area. We were talking about some of the things that affect the skin. So many things out there, too many to name, but kind of give us some great tips on some of the most relevant ones. Let's talk about, you mentioned the products, and we talked about the insects, just touched on that. But there are other things that can lead to, I guess, there's bacteria and all sorts of fungus out there. And what should we avoid, or what can we avoid?
Well, it's going to depend on your recreations and your occupations. Obviously, if you work in an office typing on a typewriter, you're not in the midst of these organisms like somebody who does under the house plumbing work or cuts cane for a living. So we live in an environment in the South that's hot and humid. It's a great place for things to grow when they get on human skin. Some of these organisms are airborne. That white sunspot fungus that teenagers get, they call it acid poisoning, sun poisoning. That's a little yeasty organism that comes through there and lands on you like pollen granules. If it happens to like it, speckles you up. It's cosmetic, it doesn't hurt. Sometimes it itches a little bit, and there are great things we can do for that. That's called tinea versicolor. But it's a tropical disease. They don't see that out in Arizona and New Mexico because the environment doesn't support it. But warmth, moisture, darkness, things like cracks and crevices, athlete's feet, jock itch, yeast infections, fungal infections. We're having a lot of staph right now. You want to keep your envelope intact. We live in this envelope. We it's like a coat of armor. You don't want chinks in your armor because that allows the world to get into you. So if you pick a pimple, if you have a razor nick, you get a paper cut, there are organisms lurking around that are ubiquitous. You can't avoid them. There are fungus spores on the rug. There are bacterial spores on the doorknob as you walk into the building. It's a matter of not letting these things have access to you, because once they get into you, the immunity system steps up to fight them, but sometimes you need help to fight them. You need antifungals, antibiotics, anti-inflammatories. Some of these things can be used topically. Some have to be taken orally. Methicillin-resistant staph is a big problem in Acadiana right now. This is that resistant staph that causes boils and Indian fire and those kind of infections. And again, the skin is where it attacks you. If it gets in through the skin because you have other medical issues, it can really be a problem. There have been some deaths nationally from MRSA, methicillin-resistant staph. Generally, they're extenuating circumstances, diabetes, AIDS, something else that sets the person up. But it's quite a problem. And anything that affords you to get infected with these organisms, scratching a mosquito bite, getting a grease burn, getting poison ivy, you don't have a good seal, and those things are accessible to you because they're environmental. I don't care how clean you are. It's not a matter of being unclean and unhealthy. You're a human being who has an attackability if you give these things an entrance into you.
Let's talk about some skin maintenance. Are there any recommendations for, of course, we talked about the sun being damaging and all of these other external and internal factors. Of course, we have different layers of the skin. What's a good recommendation just for, for maintenance? Well,
you want to have good nutrition, certainly, and it's not that you need herbs and vitamins necessarily, just a well-balanced diet. You want to stay well hydrated. Dehydration can make the skin look saggy. Probably the worst thing you can do for your skin is to smoke cigarettes. There's nothing good can be talked about with tobacco use. It ages you prematurely. It increases the risk of skin cancer. It makes you wrinkle because it breaks down the dermis. There are 3 layers of the skin. The epidermis is the top layer, which is interfacing with the world. The dermis is where the collagen elastic tissue are. So sun breaks that down. Aging breaks it down. But tobacco does terrible things to it. So don't smoke cigarettes. Don't lay in the sun. Do everything in moderation. I'll use a lot of soap-free cleansers because soap is drying. You don't want to scrub and buff and be mean to your skin. Moisturizers are nice, and if they contain a sunscreen, that's even better for the sun you don't plan to get. And you have ways you can do some damage repair, retinoids and different resurfacing things that can be done. There are plenty of ways to enhance a person's beauty, if you will. But some of this is damage done. A problem avoided is better than a problem corrected. Just don't get the damage in the first place.
So there's no way, once that part of the dermis is damaged, to build it back up again, or collagen building back up again?
You can inject collagen in fillers. Some of the retinoids will stimulate collagen elastic tissue, like retin-A and those kind of compounds.
What about the microdermabrasions and the laser treatments?
Well, those are resurfacing deals. They're maneuvers. You just take off the top layer of the skin. I mean, if you fall down on the sidewalk and knock your elbow, knock the skin off your elbow, that's a dermabrasion, okay? Now, it's uncontrolled. So a dermabrasion is to remove the stratum corneum and maybe a little bit of the epidermis. What the body does with that injury is it replaces it. So either you have to get it redermabrated or you do something in the meantime to maintain that between the resurfacing procedures you do. But the bottom line is do no harm. Do no harm.
Some excellent advice that you provided for us, Dr. Ronnie Daigle. And of course, your office is on Hospital Drive, near Lafayette General, and the address, you want to give it out?
It's 155 Hospital Drive, Suite 404.
Okay. So many interesting things you shared with us this evening. So thanks for joining us, and please come back. And that's going to do it for Healthwise here on RTV KDCG. Thanks for tuning in this evening.
Healthwise is brought to you in part by Opelousas General Health System.